Welcome to the Quark-SONG2 channel, where we explore health, nutrition, and scientific lifestyle knowledge in a way that is approachable, easy to understand, yet still grounded in clear medical evidence. Today, we will analyze a very important but often overlooked topic: 7 silent warning signs of high blood pressure, a condition known as the silent killer. High blood pressure, why is it dangerous yet hard to detect? High blood pressure, hypertension, is a condition in which the pressure of blood against the artery walls remains elevated over a prolonged period, according to cardiovascular specialists. Most people with hypertension have no obvious symptoms for many years. That's why many only discover the condition after serious complications occur, such as stroke, heart attack, heart failure, kidney failure. The danger lies in the fact that high blood pressure silently damages blood vessel walls, the heart, brain, eyes, and kidneys every single day without us realizing it. Higher risk groups include people over 30 years old, individuals who are overweight or obese, people with diabetes, those with kidney disease, individuals with a family history of hypertension, people under chronic stress, physically inactive, or consuming high-salt diets. Regular blood pressure monitoring and early recognition of warning signs are extremely important. Below are 7 silent signs you should not ignore. 1. Morning headache upon waking. Blood pressure naturally follows a circadian rhythm and tends to rise slightly in the morning. However, in people with hypertension, this increase may exceed normal limits when pressure inside blood vessels rises significantly. The small vessels in the brain are placed under greater strain, leading to heaviness at the back of the neck, dull pain in the occipital area, a tight, band-like sensation around the head. The pain often appears early in the morning and may lessen after moving around. If this happens repeatedly, especially with dizziness or mild nausea, you should check your blood pressure. 2. Persistent fatigue without heavy activity. When blood pressure is high, the heart must work harder to pump blood against increased vascular resistance. Over time, the heart muscle, especially the left ventricle, thickens. The heart consumes more energy, pumping efficiency gradually decreases. As a result, you may experience ongoing fatigue, reduced endurance, a feeling of exhaustion even without strenuous activity. This symptom is often mistaken for lack of sleep, stress, or aging. However, if it persists without a clear cause, blood pressure irregularities should be considered. 3. Shortness of breath during daily activities. Mild shortness of breath during exertion is an important but frequently overlooked sign. Long-term high blood pressure causes the heart muscle to thicken and become less flexible. When the heart cannot relax properly during the filling phase, diastole, pumping efficiency declines, leading to breathlessness when walking short distances, difficulty climbing stairs, feeling winded even while talking and walking. If you notice a clear decline in your exercise capacity compared to before, don't simply attribute it to getting older. Check your blood pressure and heart function. 4. Blood vision and eye strain. The retina allows doctors to directly observe small blood vessels in the body. Chronic high blood pressure can cause retinal blood vessels to narrow, thicken, leak fluid, develop small hemorrhages. This condition is known as hypertensive retinopathy. Symptoms may include temporary blurred vision, persistent eye strain, increased sensitivity to light. Many cases have no clear symptoms and are only detected during routine eye exams. Therefore, eye checkups are not just for vision correction but also for early detection of vascular damage. 5. Palpitations even at rest. Some people feel their heart beating strongly and distinctly even while lying still. When blood vessels lose elasticity and peripheral resistance increases, the heart must contract more forcefully to overcome that resistance, causing strong, pounding heartbeats, unexplained palpitations, a sensation of a more forceful heartbeat than usual. These symptoms may appear intermittently, especially during stress or after consuming caffeine or alcohol. 6. Recurrent nosebleeds or facial flushing. This is not a common symptom, but if it occurs repeatedly, it deserves attention. High blood pressure may rupture small capillaries in the nose, cause dilation of facial blood vessels. Possible signs include spontaneous nosebleeds while at rest, facial redness without an obvious reason. Not all nosebleeds are caused by hypertension. However, if they recur frequently, particularly in middle-aged adults, blood pressure should be checked. 7. Gradual decline in exercise tolerance. Long-standing hypertension causes blood vessels to thicken, harden, lose elasticity. During physical activity, oxygen demand increases. However, stiffened blood vessels cannot dilate adequately to increase blood flow. This leads to quick fatigue during exercise, inability to sustain activities as before, shortness of breath even with light intensity. This is a subtle but meaningful sign reflecting progressive cardiovascular changes. Why you should not wait for symptoms before seeing a doctor. The most concerning aspect of hypertension is that most patients have no clear symptoms. Many only discover the condition after serious events such as stroke, heart attack, heart failure, kidney failure, vision loss due to retinal damage. Measuring blood pressure takes only a few minutes but can prevent life-threatening complications. How to control and prevent high blood pressure. Monitor blood pressure regularly, especially after age 30. Reduce salt intake, maintain a healthy weight, exercise at least 30 minutes daily, limit alcohol and avoid smoking, manage stress effectively, adhere to treatment if diagnosed. Hypertension is not a death sentence, but it is a lifelong condition that requires proper control. High blood pressure is called the silent killer because it progresses quietly yet causes severe consequences. Morning headaches, persistent fatigue, mild shortness of breath, blurred vision, palpitations, recurrent nosebleeds, or reduced stamina may seem minor, but they can be significant warning signs. Listening to your body and checking your blood pressure regularly is the simplest way to protect your heart and prevent stroke. Thank you to all of you for following today's content. If you found this video helpful, please share it so more people can become proactive in protecting their health. See you again in our next episode on Unexplained, where we live healthy, live informed, and live proactively every day.